Do they lie? Of course they lie. When do they lie? They lie to get out of trouble, right? So, did you do your homework? Of course I did my homework. Did you take out the garbage? Oh yeah, I took out the garbage. Who broke this glass? Not me. Right? To get out of trouble. So yes, sometimes in a sexual abuse situation they may lie. That's true. But think about the consequences of their lie. They get to talk with 3 or 4 complete strangers about pretty embarrassing stuff. So it's really, think about what happens. What happens if it's a lie? And we do play both of those scenarios over in our head as clinicians. Could this be true? Could this not be true? But it's not the typical lie. So the most common lie that we see with sexual abuse is a sexual abuse victim who's recanting her story for all the reasons we've already discussed. Because of the family response, because they want to take everything back. And it's anywhere from 4 to 22% are thought to recant. Sometimes a lie is really the way the question was asked. And I have a lot of difficulty trying to evaluate situations involving young children, 3, 4-year-old, just a little bit verbal, okay? And perhaps, let's say they go to school and they're grabbing at their genitals. And somebody says to them, did somebody touch you there? Who touched you? Was it daddy? Do you see how that can happen? The suggestive questioning in a very young child is a slippery slope. It's very difficult. Once the child is locked into those answers, it can be difficult later down the line to go back and reconstruct what information the child really gave. So I'm just saying in some scenarios that initial questioning can lead down a road that's really not quite right. Also, abuse is fabricated. In my experience, I don't see all the victims. I see children who have already gone through part of the investigation and the police or CPS are referring. So I'm seeing a select group, pretty much. But sometimes there is fabrication. There is an outright made-it-up lie. And most of the time it's in an adolescent child who's old enough to carry that off. And often it's a distractor from misbehavior. So the typical one that I see more often would be like a 13, 14-year-old girl who went to a party, gets picked up later, and she tells the parent, I was raped, sort of as a detractor. Custody disputes is another thing entirely, and that can be very difficult, the kids that are caught in the middle. Sometimes I don't think they're lying so much as trying to please the parent that they're with, that they're saying things they think that parent wants them to say. And that's another very, very difficult scenario to sort out. So what happens after they tell? Good news, bad news again. What happens in a scenario where we have, for example, a male family figure who's the abuser, and we have a child who is the victim? What does the mother do? Well, 60% of the time in that specific scenario, they believe and support the child. They do the right thing. 20% of the time, they flat out don't believe the child, don't report, and about 20% of the time, they don't know who to believe. And these are the families that are often coming to the medical to decide it. So if the exam is abnormal, they're going to fall on the side of the fence with the child, but if it's normal, they fall on the side of the fence with the abuser. And of course, both exams are normal, so those are the families you have to work with very carefully and tell them most exams are normal. The history from the child is the most important. Sometimes we'll have mothers doing very ineffective things, and what I mean by that is perhaps the child tells them about the abuse, and the mother's response, because they want to keep everybody, is to go to the abuser and say, I don't know if you're doing this, this is what my child says it, but you better stop. I like the response that one mother had to it, and I mean that in a sarcastic way. She gave a lock to her daughter and said, here, lock your door at night when you go to sleep. So it should not be surprising that when we are talking to kids about abuse, the disclosure, the child telling you that something happened, that's a process, it's not an event. process. There may be little pieces in the beginning. Sometimes they take the pieces back and be little pieces again, or they may recant at any time. It's a process through time. They may give you everything and always give you everything. They may give you a little bit, and they may take all or part of it back at any time. So partial disclosures and non-disclosures, we talk about kids that just tell us a little bit or deny abuse, even if we've got evidence that it happened. Partial disclosures are statements that exclude certain types of acts. They either minimize the number of times it happened or minimize the type of abuse that happened. Non-disclosures are denials or refusals, even if we have strong evidence that abuse has occurred, like somebody witnessed it, or we have videotape of it, we have pictures of it, that sort of thing. So partial and non-disclosures are more common with family member perpetrators, children who blame themselves, children who think they may lose their family or who protect the abuser, younger children. And I mean by that would be 4, 5, 6, 7-year-olds. And the shy, reticent, slow to warm up kids. I talk about this study very often when I go to court, and I try to explain patterns of disclosure. I think this is a very compelling bit of information. This is a study, or it really is just a description of an investigation. The police recovered videotapes of 102 sexual acts involving this adolescent boy and 10 children in the neighborhood. None of the children were related to him. He was the babysitter. He liked to babysit kids. So the way the case broke is somebody found the videotape. Not one child told. It broke because they found the videotape. And they looked at the videotape and the acts and the children. And then they went and they interviewed these kids. So these kids were an average age of 5.6 years, 102 sexual acts. Children were interviewed 3 to 23 months after their last episode of abuse. So there were some children he just abused once or twice and never again, others that he was repeatedly abusing. Very interesting results. So you have 10 kids. So 3 of the 10 denied abuse despite confrontational questioning. We have the videotape, Bobby. We know Johnny did this to you. We have the tape. We have the movie. And they continued to deny it was them and that it happened to them. These children were the more severe victims. They had the more severe abuse. So these were the kids where it happened more or more happened with them in terms of penetration. Everything they saw on the videotape, or everything the children said, was seen on the videotape. But not one child disclosed everything that happened to them. Does that make sense? Not one child disclosed all the different acts that happened to them that were on the video. 2 tried to actively forget the abuse. It might be their way of saying, I don't want to talk about it. And 1 claimed to have childhood amnesia. So I think it's just very compelling to show you how infrequent disclosure is. This slide is a reminder of what happens once a child discloses abuse. And it's a summary of a lot of the points we've just talked about. Going along the horizontal axis, that's like the timeline. So there's a lot of events that can happen after disclosure, and it may happen in this order, or it may happen in different orders. So what we have here, the mountains represent stress. How much stress that child has with that event. Obviously, the mountains are different for every child, every situation, every family. But in this example, what I have here is the first 3 mountains is when the child tells 3 children, okay? And they're thinking, I can't hold it in any longer, I need to tell someone. The biggest mountain for most children is telling that adult. That is the biggest mountain for most. Will they believe me? Is at the top of their concerns. Reactive family stress. So especially if it's involving another family, then oftentimes there'll be threats, right? Across the bow. Sometimes there's violence. We've had 8 homicides in families that we evaluated for child sexual abuse that followed the disclosure. Now that's not a lot, but that's something to keep in mind, because if there's violence, and especially if there's domestic violence, it's important to remember that. And just while I'm on that topic, when do battered women, when are they most likely to be killed? When they leave. The child tells the mother they're sexually abused by that perpetrator, and the mother leaves. That's a dangerous time for the family, and especially for the mom. And we've had a couple of homicides in that scenario. CPS workers, doctors, police officers, all of those are stresses to children. And a lot of times they're just confused about what the role of each of these folks are. They're asking them the similar same questions over and over again. In any kind of large metropolitan area or urban area like what we have here, cases are at least set an average of 7 or 8 times before they actually go to trial. So as I talk to a child today, the likelihood of trial is about 2 years down the road. In the meantime, everybody's getting subpoenas. We're going to go to trial. Oh, no, we're not going to go to trial. We're going to go to trial. Oh, we're not going to go to trial. So that, again, it's something that's on their mind, some reminders. And of course, in some situations, they testify. Most of the kids I see, it never goes to trial. There's a lot of things that happen to cases, and I don't exactly know all the things that happen, but of about 1,000 or over 1,000 kids a year that we evaluate between the emergency room and Center for Miracles for sexual abuse, maybe 30 to 40 trials a year. So very few. But it's still a stress that they're going through. Another quote. I want to go back to him. Maybe if he took lots of cold medicine at night, he would just sleep instead of touching me. These kids try to come up with all kinds of ways to try to scotch tape their families back together. Very sad. You know, they're willing to put out so much. Okay, I'll talk about what we can do. Be alert to behavioral changes. Now, behavior changes are not always specific for sexual abuse, but they may signal that something's going on in the home. Changes that are the kinds of things that I would be concerned for would be changes in school performance, gazing off in class. These are changes. That's the key thing, is that there's something different about the child. Withdrawal from friends and teachers, reluctance to go home, signs of sleep deprivation. A lot of our children were identified because they left hints in their diaries or their texts or things they've written for school. They left hints. Hints in conversations can also happen. Concerns voiced by friends are also very important. If you're going to talk to somebody, there's a way to do this so it's not threatening and at the same time gives them some things to think about. Even if they say no to your question, has anything happened to you? The things you say to them, they're absorbing that, they're percolating. and sometimes later, they're going to think, I told that person, I talked to that person about something, and I think she'll listen to me now. So you're identifying yourself as someone who can listen. That's really the key piece that you want to bring when you have these initial interactions with a child or an adolescent that you suspect has been sexually abused. So show that you're comfortable with the topic, sexual abuse. But I think to be less threatening, go ahead and talk about bullying, because that's huge today. And it very much affects kids. Harassment, physical abuse, sexting. Amazing how many of those are happening too. But just let them know, I've talked to lots of kids about these things, and it can really mess up their heads. It can really mess up the way they work at school, how they function. They sometimes feel anger. So let them know you're comfortable with these topics. Acknowledge the difficulty, okay? I know that these questions are hard to talk about, and I really do appreciate you talking with me. Outline the reasons why disclosure is a good idea. Some of the kids that I've talked to have told me that things have happened to them. The only way to get it to stop is to tell someone that can help you. That's the only way to get it to stop. Another thing, though, that's very interesting is that victims are often so sure that this isn't happening to anybody else. And sometimes that trigger will be the information that when kids are touched like this, it's often happening to other kids. And you have to watch their face, but sometimes they get very interested in that. And it's like, you know, even though people think it's not happening to anyone else, people that do this to kids find ways to do it to others. That's part of what they enjoy. And sometimes that's just enough to get them to tell. In a school setting or a group setting, I've gone into some high schools, it's been a long time, and I'll ask them, what would you do if a friend told you this was happening? That's a less threatening topic than saying, what would you do if this was happening to you? What would you do if a friend told you about that? And also made you swear not to tell. What would you do? What kind of things would you say? And get them to talk out loud about that. I think that's a really good exercise for a group. Also, though, when you do broach this topic, give them a way, give them a lifeline, give them someone to call, give them your number, tell them how to contact you confidentially. In my business, we never say, trust me, I'm a doctor. I never walk into a room assuming a child is going to trust me. I certainly understand why they wouldn't, from where they're coming. My job to try to earn that. And I don't always earn it. There's lots of times where kids shut down and they don't say anything. They don't say anything. I respect that. I let them know I'm still worried about them, though. So don't assume you have to earn the child's trust. Be honest, informative, and respectful to the child. Give them permission, because sometimes they come in and I can't say those words. My mommy or my daddy told me I can't say those words. It's okay here. Your mommy said it's okay here to talk and say those words that you need to say. Tell them why you're worried, but don't peddle your suspicions, okay? And that's hard because sometimes you know in your heart that something's happened to this child and you think you know what it is, but you have to be careful because that might affect the way you ask the questions. Have to be careful with it. Give the child time to think about it, to percolate it, about what you said. Don't give up. If they don't say anything, don't give up. Give them some things to think about. And if it's happened to them, maybe that'll make the difference. Always talk with them in a private, quiet place. And this is just some samples. You seem distracted in class lately. What happened? Not who hurt you. That's a leading question. Okay? What happened? What's going on at home? Also, for younger kids especially, be aware that when you ask yes, no questions, that can be an escape for the child because they know how to answer your question to stop it. Are you worried about anything? No. How are things going on at home? Are they okay? Yeah. You see? That doesn't allow them to elaborate. So sometimes we kind of go to that because we're trying to make it easy for the child. Got to get them to verbalize. Because yes, no questions for kids that don't want to talk. They know exactly how to answer those. Look and listen, don't lead. Thank the child for talking with you. This is hard stuff to talk about. Thank you for sharing this with me. Be sure you understand what the child is saying. Be very concrete, okay? One kid said, we had sex. Sex means different things to different people. What do you mean when you say we had sex? Well, you know, he's put his mouth on mine and he stuck his tongue in my mouth. That's sex. Okay. We don't, even with the adolescents, we ask them that because sometimes they may come up with anal penetration. It may not be vaginal penetration. It's not, it can be anything. So if they use words like that, be sure you clarify what they're talking about, if you're not sure.